3 Surefire immune prescriptions to prevent shingles that causes facial paralysis and strokes. Even a slight brush of clothing brings tears to your eyes. This is the worst pain imaginable, a common complaint among shingles patients. If you had chickenpox as a child, that virus doesn't die, it hides in your spinal nerve ganglia for the rest of your life. When you are healthy, immune cells called T cells suppress the virus, but if your immune balance breaks, the tables turn. Especially if you are over 50 with naturally declining immunity, a menopausal woman, or someone with a chronic illness. You become the #1 target for this virus. Shingles is not just a simple skin disease. This is because the awakened virus travels up the nerves to the skin, ruthlessly destroying nerve cells along the way. Initially, you may feel achy and feverish like a cold, and 3 to 7 days later, a band-like red rash with blisters appears on one side of your body. If you miss the golden time for treatment, terrible complications that you will regret for life begin. If the virus invades the facial nerves, it can cause blindness, hearing loss, and severe facial paralysis. If it attacks the lower abdominal nerves near the buttocks, bladder control functions can break down, leading to severe urinary problems. The most fatal complication is the invasion of the cranial nerves. Within the first 3 months of a shingles outbreak, the risk of stroke spikes by a staggering 1.6 times. So, what should we do to prevent this terrifying shingles and rebuild our collapsed immunity like a fortress? I will share 3 perfect countermeasures proven from the perspective of the world's best immunology. First is the fastest and most powerful shield, vaccination. Unlike live vaccines in the past, the recently developed inactivated vaccine, or recombinant vaccine, shows an overwhelming prevention effect of over 90% in people aged 50 and older. Even immunocompromised cancer patients or those with chronic diseases can receive it safely. So you must consult with a specialist and seriously consider getting vaccinated. Second is an anti-inflammatory diet that directly wakes up sleeping immune cells. The beta-glucan, abundant in shiitake mushrooms, supports our body's police force by activating macrophages to directly devour the virus. Also, omega-3 in blue-backed fish lowers chronic inflammation levels in the body, creating the optimal environment for immune cells to fight without malfunctioning. Conversely, foods that rapidly spike blood sugar, like bread, and refined carbohydrates such as noodles, along with excessive alcohol, cause inflammation in blood vessels and destroy your defense lines, so be careful. Third is moderate intensity exercise that simultaneously raises body temperature and immunity. High-intensity exercises that leave you breathless actually release free radicals in your body, temporarily destroying your immunity. Consistently do walking exercises where you can smile and talk with the person next to you, breaking a light sweat, for 30 minutes, 3 times a week. Especially squats, which build thigh muscles, raise your basal body temperature, making it the best immune exercise to maximize the activity of white blood cells. Shingles is the final warning letter sent to us by our collapsed immune system. I hope you firmly protect your healthy daily life with the anti-inflammatory diet, walking exercise, and vaccine I shared today. If today's video was helpful, please subscribe and like, and I will return with more useful and accurate health information. Thank you.